Hello, my name is Courtney Butler Robinson, and I'm here today to talk to you about yoga for special populations and tell you a little bit about what that means and a little bit of my history and an introduction to this course. So, yoga for special populations is looking at populations that we would consider not general population. And the term general population is kind of a healthcare field or a health and wellness field term. It's one that's often used in the gym industry or yoga studios. And as a former administrator of a large nonprofit gym, we would use that term to mean the general population would mean people that could come to general population yoga classes or fitness classes. So, for instance, your average person that's going to come in and take a Zumba class or a beginner to intermediate yoga class, not necessarily your advanced practitioner or not someone with health problems. So special populations in this instance are people who have special circumstances going on. We're going to get into that in just a little bit. And I've addressed quite a few of those circumstances in this course. Now, I have been a practitioner of yoga for almost 40 years now. I started very young with the physical practice. I then was introduced to meditation. I did them separately, not knowing about them as a cohesive unit necessarily until I was about 18. And then I went to work for a large company that was based in Ayurveda. I won't go into all that history. I also had a background. I worked in the hospitals for 2 years in the physical therapy department. I was originally started out to be a physical therapist, but switched gears and got my education in early childhood education and management. I tell you that because whether you're a teacher here today watching this, and chances are you may be, everything I did before I became a teacher has informed my practice now as a teacher. My life as a practitioner, my life when I worked in the beauty industry, in the field of essential oils and Ayurveda information. My life working in the hospitals and physical therapy for 2 years has made me comfortable working with these special populations. Working in the school for children and adults with disabilities, I was a one-on-one Medicaid waiver worker, and I implemented therapy. That has also given me the information. When I got my degree in early childhood in management, that helped me with my school because I learned to write curriculum and I learned how to manage large groups of people and to manage a business. So everything that you are doing or have done, wherever you are on your journey, will inform your work now. I'm coming to you. This is April 24th. 2020. And so if you're watching this, you know we're at a very precarious time in our world right now. And so I'm feeling a little rough around the edges, and I'm trying to get this information out to you rather quickly. I have had a YouTube channel for years, and the YouTube channel has always been just a way for me to get information out of my head to my students or my clients that ask me something, or something that came up that was relative to something that was going on. I have not done it as a business. I'm certainly not a professional in the YouTube world. I work every day in medical yoga therapy, in cardiac rehab and cancer rehab, and I was in private practice before that. So I have all the things in the yoga world. I have all the certifications through Yoga Alliance and through the International Association of Yoga Therapists. I am a CIYT, 500-hour ERYT. I have a prenatal, children's. I've owned 200-hour schools. I've owned 300, 500-hour schools. And I am a YACP. I've also owned a children's teacher training. I'm retired from that at this time. I still do a workshop occasionally, very rarely. And when we found out, I say we, my partner and I, Rena Wren, when we found out that Yoga Alliance was allowing for online education, I thought, I have all these videos, but there's hundreds of them, and they're mixed in with my other passion, personal finance. And I would like to take the ones that are specific to yoga therapy and special populations and present them to you all when working with other with clients that may have these special needs. So this is a collection of videos that you're going to see that are specific to special populations. And some of them are more in response, but I feel like you'll get a lot out of this. And when I see a patient in our clinic that's in cardiac care or in heart disease or cancer, or whether they're a veteran or, depression, anxiety, one of the things I always tell them is if you come to me on a scale of 1 to 10, and you're a 10 is you're going to run a marathon, and 1 is you just got out of the hospital, and you're a 4. If we can get you to a 5 or a 6, that's progress. And any progress will increase the quality of your life. And I look at my job as that, a facilitator of assisting people to give them the tools to increase the quality of their life and their well-being. So without further ado, let's go on into, I think I said all the things I've done. Listen, you can find anything you want about me at Courtney Robinson Yoga, or you can put Courtney Butler Robinson Yoga. I have 2 books. You can find those, The Mud and the Lotus. Just put The Mud and the Lotus, Courtney Robinson, and I think they'll both come up. So I've written a curriculum that I published for a 200-hour school, and I wrote a book about hosting workshops and retreats as well. All right. The purpose of this course, I feel like we've covered that. It's to give you some tools to better serve your clients and to help people have better quality of life. And what is more important than that? So we're going to talk about disease and dis-ease in this course, diseases such as cancer and cardiac disease, but also conditions such as sciatica or low back pain. Some of these are very common. I don't talk a lot about scoliosis in this, but I have seen a lot of scoliosis. And in the PT field, we might try to strengthen the opposite side, the side that was the weaker side. But in the yoga field, generally, from my perspective, as being someone with severe scoliosis and seeing many, many hundreds of people with scoliosis over the years and working with them and preparing them even for surgery, I have found that a well-balanced practice with a seasoned teacher who knows what they're doing and knows what to look for has been very beneficial. And that is the way that I have come at it. So, all right, prevention. So there are times in your life where you're trying to prevent disease, and there are times of your life where you're recovering from disease or illness or condition. There are times when, so we call that the recovery stage. And then there are times when we're trying to restore our health and times when we're trying to preserve our health. So I will cover that in various forms throughout this. So for instance, right now, I might be trying to prevent cancer. Someone else might be trying to recover from cancer, going through treatment. Another person may have gone through treatment and they're trying to restore health and vitality to their body. And then they're trying to prevent it from coming back and preserve their health going forward. So we'll talk about all of that. Those are different stages. And so that you can see very quickly where this is for everybody, right? I'm also going to cover 12-step recovery in here. I am trained in yoga of 12-step recovery with Nikki Myers. I also have personal history. I am a member of Al-Anon, which is a support group for family members who have had addiction in their families. So I'm very familiar with it. We'll talk about things like emotional issues, like feeling less than, feeling guilt, feeling shame, feeling anger, and how to deal with that through the lifestyle of yoga. And you'll see very quickly, I'm very much about the lifestyle of yoga, not just the physical practice, not just the asana practice or the pranayama, the breathing or the meditation, but the lifestyle of living the first 2 limbs. And if you're not familiar, if you have my book, that's great. The yamas and niyamas, the 8-limb system is in there. But if you just want to go into your search bar and Google or search for the 8 limbs of yoga, I would highly encourage you to do that, because if you're a teacher, you're probably familiar. I hope you are. But if you're not, no shame in that. Just learn about it and begin to understand how the yamas and niyamas are part of living a yogic lifestyle and how our daily life is yoga. It's all yoga. So We'll talk about physical, emotional health and the methodology of what you do and how you do it throughout this course. They are interspersed throughout the courses, but they are in separate categories. And you're going to notice some themes of similar things throughout this course. And also I address some issues that happen for teachers, like feeling as a teacher, feeling maybe burned out and how to deal with that. Because here's one thing I know. I love my job. But I created a job for myself that was, for better lack of, I don't have a great word to say, hobby, right? So you could say exercise was my hobby, meditating hobby or part of my life. And I created a work out of that. And all work has some element to it that is hard or stressful. And so I've been through burnout many times in my life. And I share a little bit about that in some of these videos. So before we go and you start watching these videos, I want to say you can reach me. My email is cdb. So my pre-married name this time was Courtney Denise Butler. So like cat, dog, boy, 120@gmail.com. You can go to my website, balance with a B, yogaandwellness.com, or you can simply Google me, Courtney Butler Robinson, and put yoga and everything will come up. I'm happy to answer your questions. I'm happy to answer emails. If it's something that you need in detail, I can do a private session with you. My rates are very reasonable, but I'm happy to just answer simple things and small things that don't take, more than 15 minutes online. It's not a problem at all. All right. Well, I appreciate you being part of this course and taking it for your CEUs. If you're watching this before June 30th, 2020, right now they're allowing contact hours. So that's awesome. All right. Have a great day. Bye-bye.